करू ना good afternoon to all of you. How are you? I hope that all of you are keeping good health. Okay, and my appeal, just follow all that is the health precautions to avoid infection, and being medicos we must be very much careful. Same time it is our job to make aware the other people about the dangers of that is the COVID. Okay, now coming to that is today's topic. If you remember that last time we were discussing about that is the blood pressure, and I will just try to that is the remind some of the things. We have seen what is the basic difference between artery and that is the vein, and also we have also seen that what is the which are the principal arteries in our body, which are the principal veins in our body. Same time we have seen that when the blood is flowing through that is the blood vessels, that it is governed by some of the physical laws which are applied to the fluid dynamics, and these laws which are applied to the blood regarding its blood flow through every part of the body, through either pulmonary circulation or the systemic circulation. These laws which are applied to the blood or the fluid dynamics is called as the hemodynamics. That also we have seen which are the factors which affect that is the viscosity of the blood, then which are the factors which determine arterial blood pressure and its flow, and so on. Similarly, later on we have seen that is what is the relationship of diameter with the velocity of the blood, and we have seen that is in the ascending aorta the maximum that is the blood velocity that is 63 centimeters per second, and that of the vena cava it is 11 to 16 centimeters per second. Then we have come directly to the definition of that is blood pressure, and we have defined that the blood pressure as the blood pressure is the lateral pressure exerted by flowing blood on the walls of the blood vessel, usually expressed in the millimeters of the mercury. Now, since this is the old tradition, still we express the value of a blood pressure in the millimeters of mercury. In most of the countries, as I have mentioned last time, mercury is banned for recording since it is poisonous. However, instead of that, the unit of kilopascal is also used. Clinically, blood pressure is determined in an artery. That is, we call it as the arterial blood pressure. Why not in the veins? Because veins is the low blood pressure system. The blood pressure exerted by the column in other types of blood is also determined. For example, in the capillary, that in the venous, and that is also called as the capillary pressure, and that is the venous pressure. Now, which are the types of the bloods? We have seen there are 4 basic types of the blood pressure: systolic blood pressure, diastolic blood pressure, pulse pressure, and that is the mean arterial that is the blood pressure. Now, what is the range of the systolic blood pressure? Generally we consider it is 105 to 135 mm of mercury. Diastolic blood pressure is 60 to 90 mm of mercury, and pulse pressure is what? That is the difference between the systolic blood pressure and diastolic blood pressure. Now, mean arterial blood pressure is what? Is nothing but diastolic blood pressure plus 1/3 of pulse pressure. Now, suppose that if the diastolic blood pressure is 90 and the pulse pressure is considering systolic pressure is 120 and diastolic pressure is 80, but difference gives is the difference of a pulse pressure is 40. And if you take 1/3 of this value, this our mean arterial pressure will fall in the range of 60 to 100 mm of mercury. Mean arterial pressure is what? Is the average blood pressure in a person's arteries during one cardiac cycle. It indicates a better indicator of perfusion of the blood to the vital organs than that is the systolic blood pressure. Now, mean arterial blood pressure also we can just determine that is diastolic blood pressure plus 1/3 of pulse pressure, and in some of the books you will find this type of the formula, and the normal range they give is 60 to 100 mm of mercury. mean arterial pressure more than 100 mm of mercury causes blood clot, damage to heart and muscles. Mean that is the what I mean to say. When mean arterial blood pressure exceeds more than 100 mm of mercury, it causes blood clot. It causes damage to the heart muscle. It also causes heart attack, heart failure and kidney failure. What will happen if say the mean arterial blood pressure falls below 60 mm of mercury? It causes sepsis, stroke, internal bleeding, then and since blood and nutrient supply is reduced to the organs to cause its damage, since the blood flow is less. Now this figure shows here say that is the say record of say that is the a pulse, say that is what we call is the blood pressure. That is, it shows the systolic pressure and diastolic blood pressure. We can see peak indicates systolic pressure and the say that is the this say bottom say that is line shows here that diastolic blood pressure. If you take a difference, that will show you the that is the pulse pressure, and the dotted line indicates here that is the mean pressure. Now you will find the blood pressure say varies or changes in different vessels of the systemic circulation as blood flows through our say circulatory system or through say various say blood vessels. For example, in the left ventricle you will find that blood pressure is say about 120 mm of mercury. Then as it proceeds to the large, as it proceeds means blood flow proceeds to the say that is a large artery, you will find that it is still say is about 120 mm of mercury. When it reaches to the small arteries, say that as the blood moves away from the heart, you will find that there occurs a fall in the blood pressure. And a stage comes across the say that is capillary, say where you will find that this blood pressure is in the range of say approximately say that is in the 10 to approximately 10 to 15 mm of mercury, and these are the what we call it the exchange vessel. That is the exchange vessel. And when it comes to the say venules, it says still falls to the lesser value. This is the variation of the blood pressure in different vessels of the systemic circulation. Now that we have also seen some of the say that the factors, you may say physical factors affecting blood pressure, that is heart rate, then that is say stroke volume, then arterial elastic constant, then arterial blood volume, then peripheral resistance. These are the some of the factors which affect that is the blood pressure. Similarly, if you remember that later on extensively we have seen that is the physiological factors which affect that is the blood pressure. For example, age. Now in healthy women both systolic blood pressure and diastolic blood pressure rises with age. Now remember that all the time the value or the result of say blood pressure is expressed as a say that is the fraction. The numerator indicates systolic blood pressure and denominator indicates a diastolic blood pressure. Now at birth you will find the systolic blood pressure is approximately 40 mm of mercury, that is in the range of 20 to 60 mm of mercury. However, it rises rapidly up to 1 month of age. That is, systolic blood pressure becomes 80 mm of mercury and then rises slowly. At the age of 17 years, the normal adult level of blood pressure is about 120 by 80 mm of mercury. However, at about say that is 70 years of age, the normal value of blood pressure is about 160 by 90 mm of mercury. The increase in the blood pressure is associated with the advancing age due to the increase in the rigidity of the blood vessel wall. Why? The say the thickness of the walls increases due to the deposition of the plaques that I have explained you last time. Now the other factors we have seen sex, then the effect of the meals, emotion, climatic temperature also affect the blood pressure, exercise also affects the blood pressure. Now effect of gravity also we have seen, then sleep, then body build, diurnal variations also we observe in the blood pressure. Say systolic blood pressure shows the diurnal variation of about say 6 to 10 mm of mercury, value being say lower in the morning and say that is morning and higher in the afternoon. In night workers, a reverse rhythm is observed. Familial tendencies of the hypotension or hypertension with systolic blood pressure are say that is the common. Posture also affect, that is the blood pressure. Size of also arteries also matter to the, say, affecting the blood pressure. Then right and the left arm. This point is very important. Now there is all the time controversy, say, while recording the blood pressure, which, say, arm we should, say, select for the recording of the blood pressure. Means right upper part of the, say, arm we select here for the recording of blood pressure. You might have seen, say, recording of the blood pressure. Either we should do the right arm or the left arm. But it is observed that in about 10% of the cases, systolic blood pressure reading on the right arm is about 20 to 30 mm higher than that on the left arm. The thicker the arm, the higher is the pressure obtained by the sphygmomanometer. Now, say, depending on dexterity, now you will find some of them individuals are right-handed, some of them are left-handed, and accordingly you will find the variation in the blood pressure. Similarly, say, at the normal respiratory rate, the blood pressure falls during most part of the inspiration, but at slower respiratory rate, the blood pressure is slightly higher during inspiration. Now we have also seen then which are the, say, pathological variations in the blood pressure. We have seen, say, that is the two terminology types of hypertension, that is primary hypertension and that is the secondary hypertension. Primary hypertension is what is also, say, called as essential hypertension. Now what do you mean by the hypertension? That I have explained that hypertension refers to a condition in which systolic blood pressure is persistently more than 140 mm of mercury and diastolic blood pressure is about 90 mm of mercury. If there is only one increase in, say, that is either systolic blood pressure, it is called as the systolic blood pressure hypertension, in which pulse pressure is raised. Similarly, say, you will come across a diastolic hypertension also. Now regarding the types of hypertension, I will just repeat this part once again because this is very important for our discussion further. Now what do you mean by the primary hypertension, which is also called as essential hypertension, which is characterized by raised blood pressure without any underlying disease. Risk factors for primary hypertension include, say, heredity, obesity, mental tension and smoking. So there is a second type of the hypertension, what we call is the secondary hypertension. Refers to condition in which blood pressure is raised due to some underlying disease. Let's try to understand in the essential hypertension that, say, we don't know why it is caused. Say, but major factor is, say, that is the heredity that develops here primary hypertension. However, in the secondary hypertension, up to certain extent we can, say, conclude the cause or underlying, say, cause or disease for secondary hypertension. Now what are the common causes? Cardiovascular disease, for example, atherosclerosis, renal diseases, for example, glomerulonephritis, tumor of juxtaglomerular cells, then leading to, say, formation of excess of angiotensin II, what is that we will see in the regulation of blood pressure, endocrinal disorders, that also matters very much to cause secondary hypertension. So like hyperaldosteronism, that is secretion of aldosterone from adrenal cortex, pheochromocytoma, tumor of adrenal medulla, Cushing's syndrome, excessive secretion of glucocorticoid from the adrenal medulla, the neurological disorders which may produce hypertension including intracranial pressure, pregnancy-induced hypertension is noticed in some of the pregnant women. Its exact cause is not known. Either it is observed in the second to third trimester, say, without any cause. The hypertension is caused in the pregnant woman, and that is called as a pregnancy-induced hypertension. Similarly, now some of the facts. Hypertension is also called as high blood pressure. Persistently elevated blood pressure is the condition, one of the most common diseases of the cardiovascular system. That is, though it causes by the narrowed blood vessel, high sodium intake, obesity, say, our lifestyle or the psychological stress. It is also referred as a silent killer because it may not have direct, say, symptoms and set the stage for serious cardiovascular complications. May cause atherosclerosis, as arteries accumulate plaques leading to a coronary thrombosis or embolism. The second type of the pathology of the blood pressure, what we call as a hypotension, which refers to a condition where blood pressure values are below the normal range, that is arterial systolic blood pressure is below 100 mm of mercury or diastolic blood pressure is below 60 mm of mercury. There are also on the same line you will find there are two types, primary hypotension and secondary hypotension. Primary hypotension is also called as essential hypotension, is a disorder of unknown etiology. The secondary hypotension occurs due to some other underlying diseases. Such pressures are associated with decrease in the cardiac output, but sometimes with decrease in the total peripheral resistance. What are the causes? First cause is the hemorrhage, loss of blood volume. Cardiovascular diseases such as aortic or mitral stenosis or cardiac failure. Loss of tone in resistance and capacitance vessels. Allergic or toxic reaction causing vasodilation. Extreme pain also cause many of the times hypotension. Standing, that is the what we call the orthostatic hypotension. Now regarding the extreme pain, initially you will find that pain may cause increase in the that is the systolic blood pressure, but however if the pain is prolonged, what you will find that there will occur fall in the that is the blood pressure. The coughing or straining, that is defecation, if intrathoracic means where you will find that the blood pressure fall during coughing or the straining, if the intrathoracic pressure is raised to impair venous return and insufficient cardiac output during exercise fails to compensate for the vasodilation in the skeletal musculature. Then endocrine disorder, that is Addison's disease. Now how this blood pressure is recorded? Now you must have seen, if you have given a visit to any clinic, you will find there are such types of the instruments are used. Now you will find this is what we call it, this is the very commonest type which is used here in the in the most of the homes, in the clinic. This is the digital BP apparatus, and this is what we call it as, that is the sphygmomanometer. Sphygmo means which uses here, that is sphygmo means pulse, and the mano means mercury, which is used in this glass tube. But nowadays it is also replaced by color display. The LED displays are used, and this is a type of the that is the BP apparatus where you will find that manometer is not used. And here that what you will see that it is called the aneroid type of the BP apparatus. Now the major portion you must have observed is what, that is the cuff, or what we call as the arm, that is armlet cuff. Now in these two instruments you will find a pressure bulb just to raise the pressure, and in this this cuff is applied, and just by pressing a button we can know here that is systolic blood pressure, diastolic blood pressure, and that is the heart rate. But however, remember that there is also controversy which instrument should be used. This instrument can be used, but it gives lot of variation. But for mass screening, this instrument is very useful. But still people use this type of or physicians use this type of the blood pressure. Now which are the methods to record here that is the blood pressure? There are three basic methods: palpatory method, second is the auscultatory method, third is the oscillatory method. Now you can see here that is in the palpatory method. What has happened here? The cuff is applied across the arm, that is the right arm, and here that is mean the radial artery is felt, pulse is felt, and with the 3 digits there is a finger, that is the middle finger, and that is what we call it is index finger, middle finger, and a distal finger. They are put over the radial artery and the pulse is felt. Now slowly physician raises this that is the pressure across this curve, and what he does he goes on that increasing the pressure in the stepwise manner, and he will feel the pulse till the pulse is stopped. How this pulse is stopped? Say he doesn't feel, that is he doesn't palpate, this is radial artery, he doesn't feel the pulsation. Why? Because as he is raising, say that is the pressure, a stage comes, the brachial artery is occluded. When brachial artery is occluded due to the increase in the pressure, naturally the blood flow in the say radial artery is stopped and pulse is not felt. Suppose that, let us assume now, say somewhere, say our say that is the pulse is say that is occluded at say 140 mm of mercury. Next step is that the physician raises this pressure by 20 say mm, say 10 to 20 mm, means say he raises this pressure to the approximately 160 mm of mercury. This I am giving one example for the procedure. And slowly in a stepwise manner he say this releases this pressure, and same time he feels here that is the pulse of the individual, and at a stage as he is say that decreasing the pressure, at a one stage he feels the say pulse of the radial artery, and this is the say a rough estimate of systolic blood pressure. Mean when he feels the pulse after releasing this pressure, then that gives the idea about a rough estimate of systolic blood pressure. The second method is that is the auscultatory method. Now once in the palpatory method is necessary first to determine that is the approximate range of systolic blood pressure. Now you have no basic idea about say that is how to determine the systolic blood pressure. Now what happens is that similarly say the procedure is followed, and here say that is the pressure is raised to the say 160 mm of mercury, and same time say the physician uses a stethoscope, he puts the earpiece in his ear and puts the bell, the broader end of the bell at this part that we call as cubital fossa, and he releases the pressure. Now at one stage he hears that is a series of characteristic sounds. What I am saying, as he is releasing the pressure, what is happening is that due to the flow of the blood in this artery, say what happens, that is you will find that as the blood flows further in there, you will find that say he hears or listens, auscultate means just to listen. Say he listens that is a characteristic series of the sound which are called as the Korotkov sound. Normally there are say 4 types of the Korotkov sound, and so from that he determines now the blood pressure. Now remember one thing, when he hears the first sound, first Korotkov sound, it is called as considered as systolic blood pressure. And the fourth heart sound, which is say murmurish in the tone, say first to fourth. But however nowadays the end of the sound immediately after fourth is considered as that is the diastolic blood pressure. By auscultatory method, what you are going to determine, you are going to listen, that is the sounds which are produced by the release of the pressure, and due to the rush of the blood in the blood vessel, you hear the characteristic series of the sound. Appearance of the first sound is called as the systolic blood pressure, and disappearance at this stage we will consider here that is as the diastolic blood pressure. Okay. Now it requires lot of skill to say that it differentiate between these say types of the tone or the characteristic of this sound. You will learn this in the practical class. Then second is the oscillatory type of the say method, where just by, since we are not going to use here say that is the mercury in this instrument, just we have seen the dial of the instrument, and just by oscillation of this needle of this dial, we can determine here that is the blood pressure. Now according to 217 guidelines for the prevention and detection, evaluation and management of the high blood pressure in adults, say that is this is the blood pressure classification and Joint National Commission 7th report, that is the reports, and that is American say that is the Heart Association and American College of Cardiology. According to these guidelines, you will find that is how this say blood pressure is say differentiated. For example, systolic blood pressure and diastolic blood pressure. Now it is considered that say normal say that is blood pressure is less than 120, diastolic blood pressure that is less than 80, and this is the normal say that is the blood pressure. Now they have considered here pre-hypertension previously according to Joint National Commission Report 7, but nowadays according to 217 directive it is considered as elevated blood pressure when your systolic blood pressure is in the range of 120 to 129 and diastolic blood pressure is less than 80 mm. We call it the elevated blood pressure. Now there are say that is the other say that is stages. If say the systolic blood pressure is in the range of 130 to 139 and diastolic blood pressure is 80 to 89, then we call it the pre-hypertension stage, or it is called as the stage 1 hypertension. If it is say that is the systolic blood say that is in the range of 140 to 159 and diastolic blood pressure is 90 to 99, it is called as stage 1 hypertension, but according to 2017 directive it is stage 2 hypertension. If the blood pressure is elevated more than 160 mm of mercury and diastolic pressure more than 100 mm, it is called as the say that is the stage 2 hypertension. But say the blood pressure should be based on an average of the 2 careful readings on 2 occasions. Many of the time say whenever if you have visited say any say physician, what you will find is that minutely observe the method of the recording of a blood pressure. Your physician say never record blood pressure immediately. After some time he records a blood pressure say either in supine position or in the sitting position. Then just to say diagnose it say perfectly, he may take this blood pressure twice, or he may record say different say that is the blood pressure at 2 different occasions, or he may say monitor just to diagnose this the say blood pressure. Either you are say hypertension or hypotension say at 2 occasions. Adults being treated with say if they are treated with say antihypertensive medication designated as having hypertension. Now many of the time say it is necessary to tell your physician, those who are say patients of the say hypertension, they should mention here that which drugs you are using before say complete diagnosis of the blood pressure. Now this is just a idea about if you are say younger than say that is 60 years, then your systolic blood pressure should be 140 mm or higher. Diastolic blood pressure should be 90 mm or that is slightly higher. If you are 60 years or older, say it should be say that is your systolic blood pressure maybe say 150 or higher, diastolic blood pressure maybe 90 mm or higher. Systolic, if you are having a chronic kidney disease or diabetes at any stage, the systolic blood pressure may be 140 or more, diastolic blood pressure will be found 90 or that is more. Now there are say certain say regulatory mechanisms. How this blood pressure is regulated? Now these cardiovascular regulatory mechanisms are important just to maintain there is normal say blood pressure in the body. With normal systolic blood pressure, normal say that diastolic blood pressure. What is the purpose of this regulatory mechanism? To increase blood supply to the active tissue. In other words, I would say this to maintain say that is a normal say that is the blood supply to the our say active tissues in the body, or I would say minutest detail of our body, to increase or decrease blood loss from the body by redistribution of the blood. Suppose that say if you may come across some of the patients that is they have lost the blood due to some of the trauma, say that is hemorrhage or anything. Now it is also necessary for the regulatory mechanism to redistribute the say that is a blood flow. How it is caused? That is shifting say blood from the other part, fluids from the other parts of the body to the say that it is the traumatic part. And same time it is also necessary to maintain that is the blood pressure. Then third important thing is that to maintain normal blood flow during trauma, for example hemorrhage. Now what are the cause of circulatory adjustment by this mechanism? How the circulatory adjustments are made in our body. altering the diameter of the arterioles to change the hydrostatic pressure in the capillaries, altering blood storage in the venous reservoir, altering the heart rate, and that is the stroke volume. Stroke volume means what? That is the amount of the blood which is pumped by, that is the heart. During each beat we call it as the stroke volume, or during each stroke of the heart. Cardiovascular is a regulatory mechanism. They are broadly divided into two categories. Number one, local autoregulatory mechanism. Second is the systemic regulatory mechanism. That is, you will find, say, it is also categorized as chemical and the neural mechanism. Okay. In the local autoregulatory mechanism, these mechanisms operate to maintain blood flow through an organ at a relatively constant level, even with fluctuation in the perfusion pressure. Means, say, the body has a such mechanism, say, which has the ability to regulate the blood pressure at a constant level. Say, you may up to certain extent without any involvement of, say, that is the regulatory higher regulatory center. For example, say renal, say blood flow is constant. Say our cardiac blood flow is constant. Cerebral blood flow is constant. Okay, I mean there are various, say, other organs in our body where the, say, the blood pressure is, say, maintained at a constant level, and that is what we call as a local auto-regulatory mechanism. Second type is systemic regulatory mechanism, where you will find that there is a, say, chemical and neural mechanisms are included. These mechanisms operate along with the local mechanism to adjust vascular responses throughout the body. Similarly, remember that you have learned the basic chapter of the feedback mechanism. Now, however, you can say that, say, most of the blood pressure is regulated by positive feedback mechanism. That is, sorry, beg your pardon, that is by negative feedback mechanism. Also, in the, say, if there is a positive, say, that is, if there is a trauma is more, and say there is blood, mean the what will happen to regulation of the blood pressure, it may possible that body will not be able to regulate, that is the, say, blood pressure, and this will not maintain, that is normal, say, that is the blood. So what is this local autoregulatory mechanism? It is the capacity of the tissues to regulate their own blood flow is called as autoregulation. I mean, automatically the blood pressure is regulated in the specific organs. Autoregulation is a manifestation of local blood flow regulation. It is defined as the intrinsic ability of an organ to maintain a constant blood flow despite changes in perfusion pressure. What does it mean? Autoregulation is a manifestation of a local blood flow regulation. It is defined as the intrinsic ability of an organ to maintain a constant blood flow despite changes in perfusion pressure. The capacity is well developed in some of the structures of the body or in the organ, you may say, in kidneys, and it is well developed in mesentery, skeletal muscle, brain, liver, and myocardium. For example, if perfusion pressure is, say, in the range of 60 to 100 mm of mercury, say, is decreased to an organ, for example, by partially occluding the arterial supply to the organ, say, blood flow initially falls, then returns towards the normal level over the next few minutes. But it is just one example. If, say, the perfusion pressure is decreased to an organ, how? If you partially occlude the artery, any artery or arterial supply to the organ, means, what does it mean? If, say, the blood supply to an organ is occluded, what you will find that, say, that is mean that specific organ will receive the minimum blood flow, and due to which what you will find, the blood flow will initially fall. Then, say, after some time, if the occlusion is continued, then it returns to normal level over the next few minutes. This autoregulatory response occurs in the absence of neural or hormonal influences, and therefore is intrinsic to the organ, although this influence can modify the response. In terms of hemodynamics, the flow across a blood vessel is determined by the pressure gradient across its two ends, assuming that the vessel diameter remains unchanged. If you remember that, we have seen this, when perfusion pressure, means that is how it is related with, say, that is the perfusion pressure and that is the, say, ratio, that is the resistance. When a perfusion pressure, means that is what we mean by, say, that arterial minus venous pressure, means that is the pressure which is present in the arterial and the venous end initially decreases. Blood flow falls because of the following relationship between the pressure flow and the resistance. Means that is the difference between this perfusion, this, say, there is perfusion, this is the perfusion pressure and resistance. When blood flow falls, arterial resistance falls as the resistance vessels, small arteries and the arterioles. Means what does it mean? If, say, that is the more is the resistance, the flow will be affected. If the less is the resistance, there will be, say, there is the more blood flow. Now, in the, say, in the some of the tissues, or there is a mechanism which is present in the tissues, what we call as the autoregulating tissues are those which exhibit local blood flow regulation, thereby maintaining a constant blood flow even if the perfusion pressure changes. This is very important. Means what does it mean? Even, say, perfusion pressure varies, say, the blood flow is maintained at a constant level. This is observed in the some of the tissues, and it is said that in the autoregulating tissues, means which are those which exhibit local blood flow regulation, thereby maintaining a constant blood flow even if the perfusion pressure changes. Means that is perfusion pressure means that is the mean arterial pressure. Excuse me. The blood pressure range over which an autoregulating tissue can maintain a constant blood flow is called as the autoregulatory range. Means, say, blood pressure, just to maintain autoregulation, the blood pressure should be maintained within a specific range. What does it mean? Just go back to this statement. The blood pressure range over which an autoregulating tissue can maintain a constant blood flow is called the autoregulatory range. Means your, say, that is the constant blood flow is maintained due to the specific range of the blood pressure is maintained. For example, this the autoregulatory range in our body is from, say, from mean arterial pressure of 70 to the 175 mm of mercury. Outside the autoregulatory range, the flow does not remain constant. What does it mean? Suppose that your, say, blood flow will be maintained when the mean arterial pressure is, say, is present within 70 to 175 mm mercury. If suppose that it falls, then, say, that is 70 mm of mercury, if it is more than 175, the blood flow doesn't remain constant. There is a proportional decrease or increase in flow if the mean arterial pressure falls below 70 mm of mercury or increases above 170 mm of mercury respectively. What does it say? Accordingly, you will find that, say, the blood flow will vary. There are several types of the blood flow regulation. Say, that is long-term regulation, acute regulation. Now, say, in the first is the long-term regulation. This is done by or achieved by increasing the size and the diameter plus increasing the number of blood vessels over a long time. Means that is the blood flow can be increased. Means body is having a mechanism to change the diameter and the size of the blood vessel. Means achieved by increasing the size and the diameter of the blood vessel and increasing the number of blood vessels over a long time. The second is the, say, acute regulation. This responds to the local needs of metabolically active tissues. Only those tissues which require greater blood flow owing to their metabolic activity, say, that is receive greater blood flow. Means in short, say, that is one is in the long-term regulation that the blood flow, say, that is varies due to the change in the size and the diameter of the blood flow. However, in the acute regulation, you will find that the regulation is entirely based on the needs of the body which are related to the metabolic activity. Acute regulation of the blood flow is further divided into following types: extrinsic regulation and the intrinsic regulation. Now, say, that is autoregulation is, say, that is first type. The long-term regulation is divided into, say, that is the, say, means that is acute, say, that is, sorry, long-term regulation is followed by acute regulation. Now acute regulation is further divided into two types, extrinsic regulation and intrinsic regulation. In the extrinsic regulation involves sympathetic autonomic nervous system activity and that is parasympathetic autonomic nervous system. I have written that in the short form. SANS means that is the sympathetic autonomic nervous system, and PANS means that is the parasympathetic autonomic nervous system. Means extrinsic regulation depends on these activities of sympathetic and parasympathetic nervous activity input to the regulate vascular diameter. Extrinsic regulation will be discussed later in a separate lecture. Intrinsic regulation involves mediators released from the tissue itself which ensure that adequate perfusion to the tissue is maintained. For example, that is cerebral circulation, coronary circulation, skeletal muscle circulation, that is skeletal muscle vasculature, that is during exercise, renal circulation. These are the examples of that is the intrinsic regulation. The third is the vascular system control on the blood flow. It is also involved in the regulation of the blood flow to the tissues. It falls both under both intrinsic as well as extrinsic categories. So it is discussed separately here. Certain substances that we call the EDRF mean that is the endothelium derived relaxing factor and endothelin are released which act on the endothelium of the blood vessel and itself and subsequently regulate the blood flow to the tissue. Now this factor EDRF acts to cause vasodilation whereas endothelin causes vasoconstriction. Means this is the vascular system control on the blood flow is what? Here that is the endothelin releases some of the factor and it causes vasodilation and the other factor endothelin causes vasoconstriction. In short if there is a vasodilation means there is an increase in the blood flow. If there is a vasoconstriction means there is a decrease in the blood flow. So there are various theories. Now we'll come across metabolic theory of autoregulation. What is this metabolic theory of autoregulation? When the arterial pressure increases, excess blood flow supplies more nutrients to the tissue and also releases, that is flushes means for vasodilating substance out of the tissue. Just try to understand according to metabolic theory of autoregulation. When the arterial pressure increases, excess blood flow supplies more nutrients to the tissue and also release vasodilators substances out of the tissue. Both these factors, what do they cause? They cause the blood vessels to constrict to maintain normal blood flow in spite there is increase in the blood pressure. Both these factors what? That just vasodilator and that is they cause here that is that there must be one correction here that both these factors cause the blood vessel to vasodilate to maintain normal blood flow in spite there is increase in the blood pressure. According to metabolic control is the sum of the metabolic factors that match the oxygen supply to the energy requirement. There is a remarkable proportionality between changes of myocardial oxygen consumption and coronary blood flow. If the oxygen supply is insufficient compared to the myocardial demand, a vasodilator is released from the myocyte to interstitial fluid, so the coronary resistance vessels dilate. In short oxygen supply to the heart is very important, a crucial factor in the regulating that is the blood flow in the myocardium. If there is decrease in the insufficient oxygen supply, what will happen? It will cause a release of a vasodilator substance from myocyte to the interstitial fluid and which will cause that is the vasodilation of the coronary blood pressure to increase the blood flow. Similarly, adenosine is the continuously produced by breakdown of ATP because it is such a potent vasodilator and because it diffuses readily across the cell membrane. Adenosine may work via presynaptic inhibition of the sympathetic nerve fiber. Second factor is the adenosine that also here helps to increase the blood flow. Adenosine may work via presynaptic inhibition of the sympathetic nerve fiber to smooth muscle of the coronary resistance vessel. Following perfusion pressure leads to diminished rest of the adenosine washout and thus to local vasodilation. Adenosine dilates the vessels and cause increased coronary blood flow. Increased perfusion pressure washes out the adenosine, which leads to the vasoconstriction and local decrease in the blood flow until it is re-established. There are, say, two mechanisms. We just try to understand the role of adenosine. When the adenosine is released, it causes the vasodilation and increases the blood flow. Now, this increased blood flow causes washout of the adenosine, and due to which, say, the unavailability of adenosine will cause vasoconstriction and will decrease the local blood flow until it is re-established. This is the mechanism of the metabolic aspect. Then coming to the myogenic theory of autoregulation. What is this myogenic theory of autoregulation? This theory is entirely based on the principle that sudden stretch of the blood vessel, of small blood vessel, cause the contraction of the smooth muscle of the vessel. What does it mean? That is, this is the one important mechanism in the regulation of the blood pressure and blood flow. This theory is based on the principle that sudden stretch of the blood vessel. Why these blood vessels are stretched? When, the blood flow is flowing with high pressure, that will cause the vasodilation. That will cause the stretching of the, the blood vessel, a small blood vessel, and that will, spontaneously cause the recoil of the blood vessel. That will cause, the small blood vessel causes the contraction of smooth muscle of the vessel walls. That will, in short, it causes the vasoconstriction. Therefore, increased high arterial blood pressure causes stretching of the vessel, which in turn causes vascular contraction to reduce the blood flow nearly back to the norm. However, at low pressure, the degree of stretch of the vessel is minimum, which allows increased blood flow. We just try to understand what do you mean by that. If the blood pressure is more, that will cause more stretching of the blood, and instantly it will cause recoil of the the blood vessel, and that will decrease the the blood flow, and that will help to maintain normal back the blood flow. However, if there is a low pressure, what will happen? The degree of stretch of the vessel is minimum. Means there is no contraction, and you may say that here now due to this mechanism, it allows here increase the blood flow. Myogenic mechanism protects the capillaries from excessively high blood pressure. This is a very important aspect. If there is high blood pressure, what will happen? If there is myogenic, or the metabolic mechanism is not there, what will happen? The blood flow with a rapid velocity and increased pressure will reach to the capillary, and it will cause the damage to the blood capillaries. Hence, the myogenic mechanism protects the capillaries from excessively high blood pressure. That is, if the pressure in the small arteries and arteriole rises to the high, these vessels constrict and prevent this high blood pressure to be transmitted into the capillaries, which are so weak that excessive pressure could rupture the capillaries. The same point I will just repeat it. If suppose that if the pressure in the small arteries and arterioles suddenly increase, what will happen? These vessels will constrict, and it will prevent this high blood pressure and this blood flow to be transmitted into the capillaries. And how it is helpful? Which are so weak, capillaries are so weak. Now this excessive pressure and blood flow could rupture the capillaries. Hence, the myogenic mechanism is very important. Now it is the same that is the myogenic theory that I have explained here. That is what we have seen in the autoregulatory mechanism. That is we have seen that is there are two important mechanisms. Going back to the that is our what I have told you. That is long-term regulation and acute regulation. In the acute regulation, we have seen extrinsic regulation and the intrinsic regulation. The vascular system control of on the blood flow, that we have seen. Then there are two major theories regarding autoregulation, metabolic theory, and second is that is what we call it the myogenic theory. So the second mechanism, that is say what we call a neural mechanism or say chemical mechanism. Now what does it say? The mechanism for a blood regulation. It includes say up to certain extent regulation of the blood pressure via that is nervous system and to the and so on. Now further you will find that this is the very important say blood pressure say mechanism where you will find that say this all this say this regulatory mechanism in under this category are divided in that is three categories. Under these three categories, rapidly and short mechanism, rapidly or short acting mechanism, rapidly or short acting mechanism. Second is the intermediate acting mechanism, and that is the long term acting mechanism. Under say rapidly acting mechanism, what I have seen that there are say under this category secondly you will find that
it's online.
Under this mechanism you will find that this all say blood pressure mechanisms are divided under three different categories. What are they? Rapidly or short acting mechanism. This is first category. Second is the intermediate acting mechanism. Third is the long term acting mechanism. Means in the rapidly short acting mechanism, the mechanisms which are categorized are say baroreceptor mechanism, chemoreceptor mechanism, CNS ischemic response. There are also other rapidly acting mechanisms which are involved. Low pressure receptor mechanism, Bainbridge reflex and volume receptors. Under second category, intermediate acting mechanism. Under this you will find that there are say two mechanisms are involved: capillary fluid shift mechanism, stress relaxation of the blood vessel mechanism, and third important is there is a long term acting mechanism under which that is you will find that we have to study two important mechanisms: renin-angiotensin system and that is a renal body fluid system. So means what? These are the three important say that mechanisms which are included under this category. Once again I will repeat, that is a rapidly and short acting mechanism, intermediate acting mechanism, and long term acting mechanism. Now there are some of the receptors which are say very sensitive to the say change in the say blood pressure. For example, say in the rapidly short acting mechanism, I will give one example. Say this baro means related to the pressure. These are the special types of the receptors which are sensitive to the pressure change in the blood pressure. The chemoreceptors means what? These are the receptors say which are sensitive to the say composition of the blood or say chemical composition of the blood variation. For example, mainly it is related to the change in the say that is the partial pressure of oxygen, carbon dioxide, and that is the pH of the blood. Now the CNS, these are the rapidly short acting. Why they are mentioned called as a rapidly short acting mechanism, which are say that is the which come into play within very short time of the 20 minutes. Intermediate acting mechanism, it takes a longer time. Long term acting mechanism, it may take say that is weeks. Now renin-angiotensin system, I have mentioned here, if you remember that somewhere, that is the angiotensin 1. This is the part of the renin-angiotensin system, and as I have mentioned that here, that we will discuss it later. But say before understanding, we must have a basic idea about say that is the blood pressure regulatory system. Means you will find that say you will come across that there are say the cardiac centers. Cardiac center means what? which regulate, that is the overall say cardiac activity of the heart. What is it? That is heart rate. It records, it regulates, say that is a blood pressure. It regulates the blood supply to the various organs. These are the what we call cardio, say that regulatory centers are there. They are collectively called as a cardiac center. This is a discrete group of the say nuclei which is present in the say that is our brainstem, or you may say that is at present at that is say in the say in the brain, and they are collectively called as a vasomotor center. Now the vasomotor is a portion. Vasomotor center is what? Is a portion of the medulla oblongata that together with the cardiovascular center and respiratory center regulates blood pressure and other, that is the homeostatic process. Means this is, we will come across the term vasomotor center, which is a portion of the medulla oblongata, and that together with the cardiovascular system and the respiratory center regulate blood pressure and other homeostatic process, that is consist of that is the some of the specialized area that we call it as a vasoconstrictor area, vasodilator area, cardioinhibitory area. Okay, then where it is present we will discuss in the next lecture. There is also other terminology which is say used, depressor area, then suppressor, mean they, which are used to describe this say cardiovascular system. The cardio mean alternatively these terms are used. But however, I would like to use these terms, that is the vasomotor center, vasoconstrictor area, vasodilator area, and cardio say that is the cardio say that is the inhibitory area. Okay, I will stop here. Thanks for patient listening.